Now, bioidentical progesterone transdermal cream in childbearing years. Ladies, if you desire pregnancy, you take progesterone cream days 14 through 24 of your cycle and not days 10 through 20 of your cycle. Progesterone, that's pro-pregnancy. If a lady gets pregnant, you give her progesterone transdermal cream and have her use it every day until she feels movement. It makes a great big placenta and a great big umbilical cord, and the IQ of those kids is higher than those that didn't use it. Katrina Dalton did a 25-year study in Europe, and it works every time. Okay? And there's nothing more devastating to a lady than to get pregnant and have a miscarriage. To her, she's going to have a baby. And if you give them progesterone cream, that never happens. They always have the baby. And you can't shake that kid loose. You're going to have a baby whether you want it or not, okay? Oh, me. No. Huh?
What concentration of progesterone cream?
What's that?
What percentage or concentration of progesterone?
The concentration? I give them 100 milligrams per ml. Tell them to take as much as their husband can tolerate. It's not dangerous for them, it's just dangerous for the people around them. They get pretty witchy if they get too much. Okay. I give dark-haired ladies over-the-counter progesterone cream, Dr. John Lee's progesterone cream. You can get it at any health food store. You can get that at 10 to 15 milligrams per squirt. It works real well. But the light-haired ladies all need heavier doses. I got some ladies take 200 milligrams a day while they're taking it. Yep. Now, perimenopausal ladies, tough. Ladies, when you're right between 25, 35, 40, different for every lady. 1 month you'll ovulate and the next month you won't. It's only your guess. You have to control the progesterone cream. Okay? You just have to do it. Do you have a bioidentical hormone preparation, Dr. Weiner?
A cream?
No, a capsule. Something with blue cohosh, black cohosh, squalvine, damiana. Those are all good, okay? And most companies have that. If you got one of those, they can take that, and it works pretty well, okay? And there's perimenopausal.
Men now.
Huh?
I got sidetracked. You're talking about women
Yeah.
and men.
Yeah, women.
Okay.
Because they got it. It's a tough time for them. The only people that have a harder time are ladies that had tubal ligation. Ladies, if I ever had to tell a lady not to do something, don't ever get a tubal ligation, ever, ever, ever. Because when they cut that tube, they cut the blood supply of the ovary, and you got an ovary without enough blood supply. You're a tumor waiting to happen. Okay? If you're so interested in not having babies, have your husband get a vasectomy. Okay? Most of us are we're very anxious for our wives to get a tubal ligation. And you can reverse vasectomies, but you can't reverse, it's pretty hard to reverse a tubal ligation. But it messes a lady up. I'll just tell you, they're basket cases. Only people worse than that are ladies who are under 40 that have a hysterectomy. They don't have a chance to go into menopause. They're dropped into menopause. Those ladies are a disaster. I do everything I can to help them because every lady ought to be able to be a normal lady. There are no simple surgeries, just simple surgeons. Okay? When a surgeon says it's simple surgery, ask him if it was on him, it'd be simple. All right? Simple surgery you do on somebody else. All right? I get after him. My brother doesn't like that, but I tell him that. You know, I don't like it. Now, here's the thing. The perimenopausal lady, she's going to have frustration because 1 month she will and the next month she won't. 1 month she does, the next month she won't. Now, if you get her on enough progesterone cream and she knows how she's handling it, then she can take it 1 month, and the next month she won't need any. But she's going to have to know what she's doing and know what her body's telling her. Now, here's one thing ladies can use. Oil of evening primrose. Oil of evening primrose has a lot of gamma-linoleic acid in it, GLA. GLA feeds the nervous system and helps a lot of ladies go through menopause without all the emotional nonsense. Stops hot flashes. Okay?
Dosage?
Huh? Dosage? A couple of 1,300 milligram capsules a day or more. I had a lady called me and said she was going to jump off a bridge. I knew she was in a terrible situation. I said, well, take 2 of those 1,300 milligram oil of evening primrose capsules before you go to bed at night. She thought she felt so bad she'd take 4 of them. She called me in 2 days. She said, don't you ever forget where you found oil of evening primrose. She said, I've slept for 2 days. She said, I was just stressed out. She said, I'll never be without it again. You'll never hurt anybody with oil of evening primrose, and it'll keep a lot of your patients from being on tranquilizers and antidepressants and all that other stuff. Okay? I just let people, I talked to the pharmacist a little while ago, people are on antidepressants and that sort of thing, I'll give them oil of evening primrose, I'll give them L-tryptophan. You make serotonin out of L-tryptophan. Instead of giving people SSRIs, serotonin receptor inhibitors, that block serotonin every place but to the brain, you can get toxic in those, but you can take all of the L-tryptophan you want. Every cell in the body can use tryptophan. Okay? And then do you have anything like,
That would be mood lift.
What's that?
Mood lift for the tryptophan. Mood lift?
We have a product called Mood Lift.
Blue?
Mood.
Oh, I'll bet you it does. Mood.
Mood Lift.
Mood lift. Try it. Try it. Mood lift. Anybody here tried it? Good. Good. I'll try it. We'll try it. I'm for what works, okay? If I'd heard about it, I probably used it before. Now, the other thing you can use, Life Extension has a new product called Dopamine. I was walking in the airport with a guy, and he had a cane. He was 80 years old, and I was walking beside him, and he said, I got Parkinson's. And I said, well, have you tried Dopamine? He said, tried it. He said, I was flat on my back in bed until I got it. And he said, the day after I started taking it, he said, I was walking. All I need is this cane now. Dopamine is an extract from oats, an oat extract. It blocks the enzyme that keeps dopamine from going to your brain and nervous system. Dopamine is what gives us memory. I take it every day, okay? But it stops Parkinson's, but it improves memory, and it'll keep your moods from going crazy. Yes?
Any reference between tryptophan or 5-HTP?
And what?
Or 5-HTP?
5-HTP? 5-HTP is hydroxytryptophan. It's so close to tryptophan that it's so close to the serotonin that the body has no choice with it. It has to make serotonin out of it. That's why I use tryptophan instead of 5-HTP. 5-HTP, if I get somebody that's real serious as far as their depression and that sort of thing, I'll use 5-HTP. Okay, but 5-HTP, the body has no choice. It has to make serotonin out of that. Where tryptophan, it doesn't. If you get enough tryptophan, if you get enough serotonin, tryptophan, every cell in the body can use tryptophan. But 5-HTP is stuck. It has to use that for serotonin. That help you?
Sure, thank you.
Yeah.
Dose on tryptophan?
Pardon me?
Dose on tryptophan?
I tell you, there comes 350 milligram capsules, and I give 2 or 3 of those a day. I tell people to take as much as they need. I was in charge of a detox center, drug detox center, and they were all on that kind of stuff. And I took them off that and put them on tryptophan and oil of eating primrose. Okay, good. There we go. Stress solutions. I like them. Here you go. Stress solutions. Good thing to know. Yeah, if I'd known about these things now, I'll tell you, Dr. Weiner, I'm not trying to push something. I'm just using stuff that I know. Okay.
He says he's going to come up and do a whole workshop.
Good. I'd like that. I'd like that a lot. Now, menopausal ladies, somewhere between 35 and 50, you quit menstruating and you quit using, you quit making progesterone. And see, if you don't ovulate, you don't make progesterone. And I put those ladies on bioidentical hormones. I put them on progesterone and bioidentical estrogen. Okay? If they've had cancer or they got a cancer risk in their family, I just put them on estriol. But Biest is 80% estriol, 20% estradiol. And that keeps the body from converting all that progesterone to estradiol. And I got a ton of ladies on that kind of stuff. And they like it. They don't put on weight. Okay? They're not a cancer risk. And they appreciate that more than you know. Now, hysterectomized ladies, I'll tell you, I don't have much success with them. I work on them. I try my best to help them. But my heart goes out to them because they're basket cases. Okay? A lot of them can't ever get their hormones straightened out, and most of them got frustrated and went on horses' hormones or pharmaceutical hormones, and they put on weight like a balloon. First thing doctors do when they do hysterectomy is put patients on Premarin. First thing they do. And because they know the side effects of progestins, they'll leave the ovaries in. Okay? Prempro is estrone with progestin. And they know the side effects of that and all of the problems with it, so they don't want to do that, so they leave the ovaries in. Oh, now you got two ovaries without enough blood supply. Half the ladies do right, and the other half don't. They do terrible. Okay, now, cancer victims. Who said that ladies that have cancer are not still ladies? Let me give you a scenario. When they take a breast tumor out of a lady, they have to check it for estrogen receptor sensitivity and progesterone receptor sensitivity. 85% of those tumors are estrogen receptor sensitive. You guess what estrogen they use to check that? Estradiol. You don't have to be a rocket scientist to figure where we grew that. Okay? Guess what they use? 15% are progesterone receptor sensitive. Guess what progesterone they use to check that? Progestins. I give those ladies progesterone and estriol, and they do just fine. And I get nasty letters from the oncologists and from the universities. I got one lady, 10 years, they've been monitoring her. And I got a letter from Indiana University, said, we can't agree with this lady's protocol, but she hasn't had any cancer for 10 years, and she's not going to quit the progesterone and estriol that she's getting from Dr. Streeter, and we'll keep on monitoring, but we can't agree with her protocol. Okay. Huh? Estriol.
Yeah, where do you get it?
Formulating pharmacy. Yep, they can get that. Estriol and progesterone, and I give it to them, and those ladies do just fine. Now here's another set of ladies that you really have to watch out for. And I hate to talk about it, but it has to be talked about. If a lady has a dry vagina, you better treat that because she's going to have urinary tract infections shortly if you don't. I had a lady in a couple weeks ago. She's had a urinary tract infection every week for the last year, and has been on antibiotics every week for the last year. When she came to me, I said, you wouldn't have a dry vagina, would you? She said, would I? I gave her estriol and testosterone in a vaginal cream, and she called me a week ago, and she said, this is heaven. Okay? I mean, something so simple. I had a lady come to me a few weeks ago, and she said, don't you change one thing I'm doing. She said, my husband sent me to you a year ago, And she said, you don't change one thing, but he'll be in to see you in the next couple of weeks. He got more than he bargained for. I mean, you get patients that are doing well, they'll be back to see you every year. I mean, they're just...
Don't you find most UTIs that happen frequently is thyroid deficiency though?
A lot of them,
Yeah.
yeah. Most of the urinary tract infections I see in ladies are E. coli. And I don't care how careful a lady is, she's going to get E. coli infections. And you use D-mannose for those ladies. You give them 3 grams of D-mannose every 2 hours with a big glass of water, and 8 hours will be gone.
We have a product called UT Cleanse, and it has that among many other.
Good. UT Cleanse.
Yeah,
They have a UT Cleanse that has D-mannose in it.
right, as well as cranberry. And
Good,
or something.
good, 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 good. Now here's the reason for that.
What was that dosage, D-mannose, 600 milligrams?
UT Cleanse.
Right, but before when you just said just the clean.
Yeah, D-mannose. Yeah, D-mannose, I give him, you know how many milligrams in that?
I don't have it memorized, but I bet you Mikey does.
Yeah. But I give him 3 grams every 2 hours, the big glass of water. Now here's why. The bladder has mannose on the wall of it, just enough to grow E. coli. And when you give D-mannose with a big glass of water, that E. coli follows it out just like a puppy dog, without doing any damage to the lady. Okay? She doesn't have to take antibiotics. She's not fighting a yeast infection for the next year. Okay? Now,
500 milligrams of D-mannose.
what's that?
500 milligrams.
500 milligrams of D-mannose?
UT Cleanse.
Yeah, you take 1, 2, 2, 4, 6 of those. 6 of those every 4 hours, or every 2 hours, you know, with a big glass of water, and 4 treatments will be gone. Now, for yeast infections, ladies, I use olive oil and oregano oil. Yep. An ounce of olive oil and 10 drops of oregano oil. Douche with it at night, and you'll be done with it in the morning. The olive oil is healing. The oregano oil kills fungus. Okay? But it does the trick. It beats most of the other stuff. It beats the stuff that's in the pharmacy. Okay? I had a lady come to me years ago. Her doctor had prescribed betadine dose for her. I said, you got to be kidding me. She said, did you ever see a dog slide across the ground? She said, that's what you do after you take betadine dose. I gave her olive oil and oregano oil. And she came back in and she said, I'd like to kiss you. And I said, no, my wife's she's got a license for that. Okay. But she said, it is terrible. You know, doctors ought to think before they prescribe stuff. If you don't ever do anything else, that manual you gave out, that training manual, that first section, that training manual is worth every penny of it. I mean, it tells you all the medications, what they do to you. That's worth its weight in gold, brother. I'm telling you, that's good stuff. Now, if all else fails when it comes to hormones, if I get a patient who's got a memory issue, losing their memory, Alzheimer's, I send them to my brother to put in Bio-T pellets. Okay? The pharmaceutical, or the National Football League had some players that got dementia from butting their heads against one another. One of their colleagues shot himself. It got everybody's attention. They got together and they got bioidentical pellets, testosterone or hormone pellets put in a week. Their memory and their mind was back to normal. If you want to look it up, Bio-T, capital B-I-O, capital T, capital E, pellets, P-E-L-L, medical.com. www.bio, capital B-I-O, capital T, capital E, capital M, EDICAL.com. They'll have somebody in your area that does it. I don't send everybody there, but I'll just tell you this. I don't do something for my patients that I don't do for myself first. So I had my brother draw blood on me, and he put in pellets, just a little pellet, and they put it in here, put it back here. Just my testosterone level was a little lower than he liked it to be. 470, I think, and it's supposed to be 350 to 1100. He put those pellets in, my testosterone level was 1170. I said, I don't want any more of your pellets. I'll take your testosterone stuff rather than the pellets, okay? But I want it up, but I don't want it that high.
Or is that too personal?
Yeah, but you're sure having good memory, and you're sure not to have any degenerative diseases take place. Most degenerative diseases in men is from low testosterone. Most degenerative diseases in ladies is from progesterone deficiency. Okay? I had a fella call me. He said, I got my wife back. He's my accountant. I said, what do you mean you got your wife back? He said, my wife was losing it. She got those pellets put in 2 weeks ago. He said, she's a different woman. Lost 12 pounds in 2 weeks. Said she's a different lady. Psychologically, she's a different lady. Okay? I don't use it unless I got somebody that's losing it. But I'll do whatever I have to do to keep people from wandering around, not being able to find their way around. Now, one more section if you want me to do it on weight loss. I'll just say this. I met Kevin Trudeau. 17 years ago. He had bound determined I was going to be in weight loss. I told him to get lost. Everybody I saw in weight loss weighed 300 pounds when I was in training. I mean, that's like telling me to grow hair. How stupid can you be, you know? But I read his book, The Weight Loss Cure They Won't Tell You About, and I read Simeon's book, Pounds and Inches. I said, if I ever have anybody that needs it, I'll find some HCG. I had a fellow come to me 13 years ago, weighed 398 pounds. I said, this is a good guy to try it on. I called Portage Pharmacy, my compounding pharmacy friend, and I said, have you got any HCG? And he said, I do. I said, sell it to this guy at my cost for 45 days. Let me give him a diet and let's see what happens. That was in September. He came back in January and he weighed 291 pounds. I'm in the weight loss business whether I want to be or not, okay?
Yeah, but how many calories do you want? Because that's a very low-calorie diet.
You have no problem with calories when you're on HCG. If you're a man, sometimes the ladies do, but I take HCG once a year. And I'll tell you what it does. Our hypothalamus produces leptin. Leptin tells our body cells to put calories into energy and muscle. You get fat around your midsection and all those receptors shut down. HCG reprograms your body to use leptin. Your energy goes up, your appetite goes down, and you burn all this off for energy. I don't care what kind of a weight loss program you go on, if you don't reprogram your body to use leptin, you're going to put it right back on. Now, I don't have any appetite. Since I started taking that stuff, I don't know if I probably have to work to eat 500 calories. I eat 2 meals a day. I'm never hungry. Okay? I'm more interested in a way of life than I am a crash weight loss program. For men, it's a godsend. Now, men will lose 75 to 100 pounds in a 45-day period. Ladies will lose 30 to 40 pounds. Oh my God. And it ain't fair. I give it to them and I'm the bad guy, okay? I do have a couple here in Pittsburgh though, the Fishers. They invited me down, 10 years ago for a weight loss conference. There were 11 at that conference and the Fishers were well upholstered. They were heavy, okay? They invited me back in January. No, that was January I came here and they invited me back in October. Mrs. Fisher came out to see me, and I did not recognize her. She'd lost 100 pounds. And her husband had lost 100 pounds. He said to me, I can preach now and people listen to me. They have never put that weight back on. Okay? Now, I like it. I got over 3,000 people on HCG. Okay. Some ladies will use drops. I've not had much success with drops, but no man does anything 3 times a day. This man or any other man, okay? The drops you have to take 3 times a day, and you can't miss them, okay? I take the shots. It's a little bitty insulin shot. You put it right here. Okay, just like the diabetics do. It's the insulin diabetic shot. It costs, I think, about $300. That's what patients pay for 45 days. I have them driving from all over the place. I had a lady drive in from Detroit to see me, and I said, you know how many doctors you drove past? She said, you know what they're charging for HCG in Detroit? She said $750 a shot, or $750 a visit, and $20 a shot for 45 days. She said, I'll drive any place I have to find the kind of business you're giving. Now, people drive anywhere, any place they can to get the best business they can get, okay? Now, here's what you have to do. You've got a good cleanse, okay? You do a liver cleanse before you start this. You have to do a liver cleanse. Then you do their DIM, their estrogen,
Cleanse?
Ester cleanse. You do that. You'll have to take 4 of those a day in order to get what you need there. But that will block aromatase. Then you work on your thyroid. You make sure your temperature's up above 97.8. The only people I've not had to get to lose weight on HCG are people whose temperature is below 97.8. Okay? If your temperature is below 97.8, don't start it until you get it there. You'll lose 1 pound to 2 pounds a day if your temperature is at 97.8. All right? Now, you want your hormones balanced. If you're diabetic, you want to get your blood sugar in control. Now, most generally, when you lose the weight, your blood sugar comes in control because you've got a glucose 6-phosphatase that pulls glucose out of the glycogen stores. You don't have to eat the sugar to get it. The glucose out of the glycogen stores raises your blood sugar whether you eat it or not. Glycogen is stored in the liver and in fat cells. Ugh. It's no secret that most diabetics are overweight because insulin puts weight on them. Okay? And once they lose the weight, generally their diabetes comes down too. But I'll use Ervingia. I take a bunch of stuff for my blood sugar. I don't have diabetes, but I'm 77 years old, and as you get older, your blood sugar tends to go higher. I want my blood sugar under 85 milligrams percent when I'm fasting. Dr. Epitropoulos and I are working on a research project right now where we got a nutraceutical powder we're using. We'll let you know when that powder's done. By the way, did we get that up to Northern Nutrition? I haven't had it yet.
They should, yeah.
Okay. Now, but we're using that. Supposed to use a scoop of it a day. It's supposed to bring your hemoglobin A1C right down to normal. I like that. Maybe get with them. They may want to get involved in that. Okay?
Well, we do have the sugar solved in the Pro Oranges. We've had people that were A1Cs of 13 to normalize.
Good. Good. I like that. I like that. These people got the goods. You got the goods. You've done your homework. I like that. Now,
I wanted to mention too, Dr. Streeter, with
what's that?
I wanted to mention with Nutritional Frontiers, the weight loss, what I found in my work is I combine the Berrytone #2 with the Garcinia camosia of the Frontiers.
Okay.
And I use that combination in conjunction with the Super Whey, the Super Shake, and we get some very excellent results.
Okay.
With that combination of
Whatever you got to do to get your weight off, you got to do it. The medical community is not going to do it. It's not going to happen. Yes, sir.
Yeah, you mentioned Ervingia, African mango, that's in the Berrytone.
Does it?
It's a natural version to help balance leptin and adipose.
Good. 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 Now,
Berrytone too.
yeah. Okay, Berrytone?
Berrytone 2.
Berrytone 2. Berrytone 2, okay. Now, you have to know food combining. Food combining. You eat fruits and melons alone. You wait 15 minutes before you eat anything else. You eat starch with vegetables. You eat protein with vegetables. You never eat starch and fruit together, or starch and vegetables together. Never. We're a meat and potato nation. You digest the potatoes and you find the meat around here the next day. It takes 30 minutes to digest starch. It takes hours to digest protein. Now, foods to avoid. High fructose corn sweetener and all of the sugar substitutes except stevia and xylitol. And coconut sugar. You can have those. Okay?
What about date sugar?
What's that?
Date sugar?
Date sugar.
Date sugar. I expect that'd be all right. No? I don't know. I know agave is just like Splenda and all the rest of it. It raises your insulin level.
That's right.
Isn't that awful? Now, the Bible says eat a little honey. Not so much it makes you vomit. It says honey in the comb. God must know we were going to heat it. He must know we're going to overdo it. It says a little honey. Okay. Now, MSG. It used to be accent. Now it's just spices added. It raises our insulin level. See, all of these things raise our insulin level. They don't raise our blood sugar, so nobody gets excited about it. Isn't that awful? Now, NutraSweet or aspartame, sweeter than sugar, killing our kids, tears up the liver and the kidneys, and we're addicted to it. Raises our insulin level. Fattening, addicting. The hardest one's going to be refined carbs. If it's white, you don't eat it. Ugh. Ugh, ugh. You know, we're addicted to that stuff. I'm a senior citizen. I'm embarrassed at senior citizens. You go out and they all waddle. And you watch what they eat and you know why. They're on a seafood diet. Everything they see, they eat. I mean, if the tablecloth wasn't tied down, they'd be eating it. You know, it's terrible. Now, it's not an accident, folks. You're going to have to take responsibility for your actions. The hand-to-mouth exercise is the worst exercise we got. That's most exercise most people do. You know, I got a rebounder. I work on that every morning and every night. Why a rebounder? Because adult men, or adult seniors, have more trouble with balance and with leg strength than anything else. I'm not going to have that. I bounce on that every morning. I just told one of the people back here, I bounce on it till it's a big God and little me. I tell him not to get that mixed up. Okay? And I do jumping jacks on it afterwards, and at night I do jumping jacks and I run on it for 5 minutes, 10 minutes. Okay? I'm not going to be like the average senior citizen. And if you just let yourself slide, you'll be that way. I spent 18 months in a federal prison for getting my cancer patients well back in early 2000. 1996, the feds came into my office and tore my office apart because I had patients had 3 months to live, and 5 years later they're still alive. You can't do that in America. That gets you in all sorts of trouble. I got a doctor friend down in Mexico, Paco Contreras. I went down to see what he was doing. His dad were doing. I came back and started doing what he was doing. I had the same success he had that got me in trouble. Okay. They'll never pick on me again. The judge got 3,000 letters from my patients. He's scared to death. He was scared to death. He said, don't you ever bring another streeter in this courtroom, in the federal courtroom. He said, they got more friends than we got. You want to take a few minutes of break, and he'll come back here, and it'll be a short presentation. We'll show you how it happens.